From the lush green lands to the cascading waterfalls, wonders of the world, the oldest habitat of territories on earth, a rich cultural heritage, a continent of 1.1 billion people, second largest and most populous, a continent pregnant with possibilities, home to 30% of Earth's mineral resources, 50% of its people under 25 years. Africa, the land of the great. Our spirit resilient. Our enterprise profitable. Our future inspiring. Africa is inspiring. Be inspired.
Hello everybody, today we're talking about equity and health, or health equity. Now it's important to emphasize that health is not merely the absence of disease. Actually it encompasses the physical, mental and social well-being of an individual, the ability to adapt and self-manage when facing challenges at all the levels I mentioned before. Now, in Africa, for instance, we find out that mental health is something that is largely ignored or shied away from because of stigma and then superstition. It's also important to emphasize that the mental health is not merely the absence of mental illnesses. For instance, conditions like anxiety, depression, drug abuse, and eating disorders must be addressed. And then therapy should be made available for all those conditions. The therapy should be well publicized so that the individuals know that they are available, and those affected should be encouraged to seek help. Now, health equity is a fair chance or opportunity of every individual in a social group, within social groups, or amongst different social groups to live a long and healthy life. Now, deliberate efforts must be made to eliminate the gaps in health outcomes between social groups. All the issues that ensure that these gaps exist must be addressed, and context-specific solutions must be tailored to ensure that each group or each person within a group and amongst groups benefits. That means that the health need of every individual in a society must be met. This means that a one-size-fits-all approach would not work. Now let me explain. For instance, if you have a group or a society or a group of 50 people, giving all of them size 10 shoes will not meet their needs, because definitely there will be people with size 6, size 8 or size 7 in that group. So yes, they have shoes, but the shoes will be of no use to them. Now, any inequities are often unnecessary, because if we can apply the right policies, if we can study our society, we will be able to find out that these things are avoidable, and usually they are considered unfair because they are a result of social injustice. Now, health itself is a fundamental human right, and in every society should be a fundamental human right. Now, it is enshrined in the WHO constitution. Right to health means that every human being must have the right or opportunity to attain the highest level of physical and mental health. Now, generally, the disadvantaged and the poorest of the poor, who seem to have poorer health, usually don't have access to good health services. And then within these groups, you find that as a result, you have higher mortality and morbidity. Like I said, they sorely need this health care, and then they lack access to it. Now you find that I've been repeating the word social all through all the things I have been saying, because beyond health science, social factors also determine health outcomes. Now, generally, these social factors, they affect health outcomes on three the different levels. First of all, we talk about health promotion and disease prevention. Now, the whole world is generally moving away from just treatment and management of diseases to prevention of these diseases. So that's one level. Now, another level is access to health services. Now, this is to ensure that when an individual gets ill, the person has access to healthcare to prevent the morbidity and mortality as a result of the illness. Access to rehabilitation is also very important because the goal here is to reduce the effects of complications and morbidity as a result of this disease. For instance, things like physiotherapy, prosthesis, wheelchairs, walking frames, dental dentures. This is to ensure that the quality of life of the individual is maintained or at least improved. But it's important to note that there's a kind of interaction amongst this list of social determinants, and there might be an overlap. Now, the first one I want to mention is income and social status. But generally, we know that you can have the elites, the middle class, the poor, and the very poor. Let me just use that as a general way of classifying health for the purpose of this talk. Now, we find out that your income and social status also determines your kind of housing, your access to potable water, electricity, and these things are also very important in health. For instance, people who live in areas with no potable water are more predisposed to cholera and diarrheal disease.